Tonight on Primetime Politics.
We're constantly assessing the new situation and making decisions based on the information.
So you think it should?
Bidding farewell to the ArriveCAN app. Reports say the Trudeau government is getting ready to move on, but what does the science say? Coming up, we'll hear from MPs as they discuss the app's merits and drawbacks, and we'll get some thoughts from infectious diseases physician Dr. Isaac Bogoch. And
why won't they cancel these tax hikes so Canadians can pay their bills?
We know Canadians need support. That's why we have a plan to give them that.
Tackling the rising cost of living. The Trudeau Liberals are moving forward with affordability measures with the help of the NDP. But how are those who are struggling economically reacting to the new programs? We'll get some assessment from the front lines. This is Primetime Politics. Hello everyone, I'm Michael Serapio. Traveling to this country may soon get a lot easier, and that's because multiple reports citing unnamed Liberal sources say the Trudeau government will soon be ending a number of travel measures. Now, if these reports are true, it would mean an end to vaccine requirements for international travelers coming to Canada, making the ArriveCAN app voluntary, and ending randomized testing at airports. But again, these are just reports, not yet confirmed by the PMO. And when asked, well, here's what we heard today from Liberal MPs.
First of all, ArriveCAN is a critical tool to process travelers with the requirement of the vaccine mandate. So we're asking, it's a tool that helps process arrivals as they arrive.
So you want to keep it mandatory beyond September 30th?
There's no decision has been made. We are, as we've said all along,
final decisions been made.
We're constantly assessing the new situation and making decisions based on the information.
So you think it should remain beyond?
This is the time to reassess those particular measures now, and once that is done, communications will follow.
This is a conversation inside government. We're taking it very seriously.
Joining us now to discuss the matter are Greg Fergus, Liberal MP for Hull-Aylmer in Quebec and Parliamentary Secretary to the Prime Minister, Melissa Lantsman, Conservative MP for the riding of Thornhill in Ontario and now Deputy Leader of the Conservative Party, and Taylor Bachrach, the NDP MP for Skeena-Bulkley Valley in British Columbia. Hello to the three of you.
Hi, welcome back.
Listen, thank you. Mr. Fergus, I got to begin with you. Will the requirement to use the ArriveCAN app and for arrivals to be vaccinated coming into this country, will those soon be coming to an end?
Well, I could tell you that the expiry date for government to reconsider this is happening on September 30th. As you know, in every previous time, every 3 or 4 months, we set an expiry period. The Minister of Health, in consultation with the Public Health Agency of Canada, experts, scientists, makes an evaluation. This is what we promised Canadians. We promised them that we would provide, make sure, and give them absolute, as best security as we can for their health. And we will take the best advice possible, and then we'll make a decision as a result of that. So based on the facts and figures that they're currently evaluating, we'll find out their decision in the next week or so.
Okay, that sounds like a long way of saying yes without saying yes. Ms. Lantsman, what do you think?
Well, look, we didn't get the science for the justification for the app from the start. We didn't get the justification of the science to keep it, and we certainly don't have any justification for the science to continue it. It seems like the government has always made this about a political decision, and it's nice to see them backing down from something that border mayors, tourism associations, chambers of commerce, and just about every stakeholder we spoke to said, drop the app. Glad to see the government's doing, but I've got one more thing, and I hope that those who were fined for not complying with this COVID theatre are returned their $6,000 fine or their plus $6,000 fine that they received for this incompetence.
Mr. Bachrach, what's your reaction to all this? What do you make of what we are seeing in reports and what we're hearing so far from Liberal MPs?
Sure. So especially at the land borders, we're hearing a ton of concerns from mayors, from travelers who are in long lineups, and from the workers at the borders who are frustrated because essentially they're having to serve as IT help desks for people who are struggling with the technology. This isn't an efficient process, and so I think if these rumors are true, if these leaks are true, and the government makes the app optional, that's going to resolve some of these concerns that we're hearing. But again, the thing we've seen from this government all along is a lack lack of transparency. They haven't explained the criteria when it came to the domestic flight mandate. We pushed them for ages to explain to Canadians what science it was based on. We still haven't gotten an explanation. So when it comes to changing policy based on changing conditions, we absolutely want a government that's responsive. We also want a government that's transparent, and that's where they've been falling down.
You know, Ms. Lantsman, you talk about the science never backing up this policy, and certainly you're right. We have heard from the travel industry. We've heard from the airline industry. They have been calling for an end to, for example, the mandatory use of the ArriveCAN app. But, you know, the pandemic itself is not yet over. So what do you tell Canadians who would still like to see travelers screened before entering this country?
Well, there was no reason that the government ever put forward for why we screen travelers. There is nothing that you do in your daily life. There are no restrictions in the province that we are currently in, or frankly, any other province in terms of screening or masking. So to continue these restrictions are frankly not in line with everything else we are doing and most of our allies are doing in the world. So I say to the government, if you have a justification for this, show your work, just like you would have in high school. We've continuously asked for that. We've been continuously denied that. And in fact, just less than a month ago, or just about a month ago, the Minister of Transport actually said that ArriveCAN makes the airports more efficient. And we've seen a summer of travel that has been horrendous. I know the Prime Minister doesn't know that. He travels privately and not through airports. But Canadians are still struggling with long lineups in airports, long lineups at land borders. It's taken a toll on our economy and certainly on our reputation.
Okay, Mr. Bachrach, let me try it with you then, because yes, we have seen long lines, and yes, people are talking about the economic impact of such measures, but again, the pandemic is not yet over. So how do you circle the square for people who are still concerned about unvaccinated, perhaps sick people crossing into the Canadian border?
So from the very beginning, we've always said that policy needs to follow public health. We need to ensure that Canadians are kept safe. We need the government to do what it takes to achieve that. And we need the government to be transparent and to explain to Canadians why certain measures are necessary, both at the time when they're established and when those measures are relaxed. I think near the beginning of the pandemic, they did somewhat better in that transparency, but it really hasn't lived up to expectations recently. We've seen decisions without any clear explanation, and I think Canadians deserve that. At the end of the day, people want measures that are based on science, that are based on public health, and as the pandemic conditions change, we want a government that's responsive.
Now, Mr. Fergus, I'll bring it back to you because you've been hearing the criticism, the concern, and based on reports out there regarding these measures, including the ArriveCAN app, there have also been Liberal MPs who apparently have been lobbying for an end to such measures, an end to the app, and that's within caucus. So I'm wondering what you've heard within caucus that you might share with us right now.
Well, I'm not going to share what we discussed in caucus, but I will share with you and with all Canadians is that all throughout the pandemic, we've always followed the science. When we've had our advisory groups that have provided information and their conclusions to the Minister of Health, we have taken decisions as a result. That's why Canada had one of the best responses in the world to this pandemic. We had comparatively, very few deaths. Comparatively, we were #1 in terms of getting vaccinated, and we've been doing really well in our measures in terms of controlling the spread. That's due to Canadians following the science. That's what the government has done, and that's what we'll continue to do. And I look forward to the next decision that the Minister of Health will take from his advisory council and share that with all of us.
Okay, now to my understanding, and again, this is based on reports, it seems like the caucus is in agreement that it needs to an end, but what you're now waiting for is the Prime Minister's approval. So if that is true, when will we actually hear the news that this is going to happen or not happen?
Well, you'll hear if it's going to happen or not happen before September 30th. And this is what we did at every time that we've come to an expiry date of the order in council. We've always announced in advance what the measures would be going forward for the next period. And so that's what we'll do this time, just as we did in every other period.
Okay. Well, we await to find out what actually happens here. But for now, Greg Fergus, Melissa Lantsman, as well as Taylor Bachrach, thank you for this. Thank you for joining us today.
Thanks so much, Mike.
So that is some of the policy and politics around the ArriveCAN app. But what about the science? Is it safe to end the mandatory use of the app? Is it safe to drop vaccine requirements for international travelers coming to Canada? To talk about this, we are now reaching out to Dr. Isaac Bogoch, infectious diseases expert and scientist. Isaac, so good to see you. Thanks for being with us today.
My pleasure. Great to see you as well, Michael.
Listen, I want to begin with your reaction here because as you heard, and really as you know, there is pressure to drop this app. Is this a risky move in any way?
I really don't think it is. I think a lot of these policies, especially related to travel, certainly many of them had their place and time earlier on in the pandemic, but I think it's also fair to acknowledge we're in a much different place right now. And I think the sun is setting on several of these policies, including the ArriveCAN app. I think we have to ask ourselves, what is it that we're trying to do with this? What is the goal? Is this to keep COVID out of Canada? Because we have plenty of COVID in Canada, unfortunately. I just don't think the app right now is really achieving what its intended purposes are, and that's okay. It just means you have to lift that policy and move along.
Okay, move along, but it's not just the ArriveCAN app, it seems, because it seems that the app itself is just one component. As reports have it, though, we're also going to be looking at the end of randomized testing on arrivals. That's going to go. So what do you make of that?
I think the randomized testing, just calling it how it is, it doesn't sound like it's been implemented as smoothly as it could have been. People get tested, and we've heard many reports of people having to find testing sites that are distant from the airport. It was very cumbersome, and it just doesn't really achieve the stated goals as well. There are pilot projects that are running in Toronto and looking like they're going to expand elsewhere, where they're going to do wastewater surveillance for incoming aircrafts and airports. And again, that's a less expensive way to answer the exact same questions. You can really track variants of concern that are emerging and that are entering the country, and that's just a very helpful way to address that issue without inconveniencing travelers.
Okay, and I'm going to pick up on a point that you said, if it's no longer working, move on. So were these measures really to try and control border entry, were they ever useful? Because really in the early days of the pandemic, as you know, the government was hesitant to bring in any kind of border measure. And as the pandemic evolved, as the public outcry grew louder, it was then the ArriveCAN app and other measures that came about. So were they ever useful?
It's hard to say, and I think we need to study this, and we need to actually critically evaluate this. But it's pretty clear that earlier on in the pandemic, when we were dealing with the ancestral strain that emerged from Wuhan, or the Alpha variant, and even to some extent the Delta variant, 2 doses of a vaccine would very significantly reduce one's risk of getting the infection and transmitting the infection to others. Now, a lot of that, unfortunately, has been lost in the Omicron era. I'd still say that the vaccine does a remarkable job in protecting people against severe infection, but it just doesn't do the same degree as it once did in terms of protecting us against getting the infection and transmitting the infection. So these policies could have at least slowed down some of the spread of COVID, not stop it, but maybe slow it down a little bit, because 2 doses of the vaccine would certainly have prevented incoming travelers from bringing COVID in at that time. It would certainly reduce it significantly. But the Omicron era really changed so many things. We know it's very transmissible. We know 2 doses of a vaccine does very little in terms of protecting us against getting the infection and transmitting to others. And when the virus changes and the science evolves, it's time to update the policy.
Okay, but the pandemic is not over. So when you talk about updating the policy, what is appropriate now? Because as you say, in the age of Omicron, getting it, spreading it, still possible with 2 doses, but it still, prevents the worst of the disease. But what is appropriate right now, given that the pandemic's not over?
I think the appropriate thing to do is really to ensure that vulnerable individuals and at-risk communities get access to the vaccine. There are people that are certainly under-vaccinated that would greatly benefit from a booster vaccine, and we're just not seeing the same degree of uptake in those populations as we should be. We know who lands in hospital. We know who gets sick. We know who succumbs to this illness. It is an older population, namely people over the age of 60, not exclusively, but that group is overrepresented in hospital and sadly overrepresented in those who succumb to this illness. We also know people with underlying medical conditions that put them at greater risk for severe infection are overrepresented in hospital, and we have to do targeted outreach. I think that would go a long way in protecting individuals, protecting communities, and also alleviating a lot of pressure from the healthcare system. What do I mean by targeted outreach? I think people can recall back to when first and second doses were going into arms. We had vaccine centers that were in community centers. We had vaccine clinics in houses of worship. We had door-to-door vaccination programs. We had vaccination programs at places of work. We had 24-hour vaccine clinics to accommodate people that work in different schedules. And we really were taking the vaccine and bringing it to the people rather than bringing people to the vaccine. I think approaches like that, especially for vulnerable communities and individuals, would go a long way.
So, and yes or no on this very quickly. So what you say is focus on building up defenses at home rather than worry about who's actually coming into the country.
I think that's appropriate at this point in time.
Isaac, always good to speak with you. Thank you for this.
My pleasure. Have a great day.
You too. What is the best way to help Canadians who are struggling with the high cost of living? The issue was debated once again in the House today. Take a listen to just a bit of what was said.
Right at a time when we are facing 40-year highs in inflation, all-time highs in increased housing prices, 40-year highs in food price inflation, record food bank use. This is the last time that anyone should be raising any tax. Will the government back down from its planned tax hikes on paychecks and on energy?
Yes, things are hard right now, but Canada is better positioned than any country in the world. We have the strongest economic growth and the lowest deficit in the G7. Employment is at historic highs. Inflation is lower in Canada than the US, the UK, and the Eurozone, and it has now come down for 2 months in a row. We'll get through these tough times together.
The cost of groceries are up by average 10%. Bread is up 15.4%. Fresh fruits is up by 13.2%. You know what else is up? Corporate profits.
As the Trudeau government moves forward with its affordability package in Parliament, at Queen's Park in Toronto, a group of provincial politicians are trying to raise awareness about how little support people on social assistance actually get. Joel Harden is the member of Ontario's provincial parliament for the riding of Ottawa Centre. He is a part of this effort and joins us right now. Mr. Harden, nice to see you. Thank you for joining us.
Pleasure to be here, Michael.
So a bit of background here for people at home. You and a group of other Ontario MPPs are trying to essentially double the payments individuals who are on Ontario Disability and Ontario Works get. And to do that, you've been living on this social assistance diet. What does that mean? How do you define a social assistance diet?
Well, the definition we took, Michael, was from what the Harris government, a previous Conservative government, said in 1995 someone could live on. So when we asked researchers to think about inflation, of what that 1995 cost of diet, that Conservative government of the day thought people could survive on, what it amounts to today is $47.60 for an individual person per week. So that's what my colleagues and I decided to try to survive on for 2 weeks.
Okay, so that is the dollar figure. In terms of practicalities, what did it mean? What was it like to actually live on this kind of budget, on this kind of diet?
Wasn't easy. I worked on the same bag of lentils and bag of dried chickpeas, dried lentils. It was cheap bread and peanut butter spread thinly for breakfast. It was a lot of the same food all day long. And moreover, because you're always thinking about your next meal, you have to prep stuff ahead of time. A lot of your day is preoccupied thinking about, how you can stretch whatever you have. And I think that's life for folks on social assistance I've spoken to, Michael. That's what everyday life is like, that constant hunger, constant suffering, and it doesn't have to be like that.
So your hope is that, again, the Ontario government, the PC government under Doug Ford, will actually double the payments. Would that then be a livable amount?
Well, it was a livable amount for 9 million Canadians who accessed the CERB in the pandemic, who because of the pandemic could not work. That's what life is like for people with disabilities, Michael. They have to prove to a doctor to qualify for disability benefits in Ontario that they cannot have access to full-time paid work. But then we consign them to poverty. $1,169 a month, that soon will be $1,200 a month. No one can live in this city, in Ottawa, on that. Or for Ontario Works, $733 a month. So it's a lot more expensive for us to make people live in poverty than to actually give people a livable income. And if they can work or volunteer on top of that, fantastic. But poverty costs us in Ontario $33 billion a year. Doubling the benefit in Ontario for social assistance, $8 billion. It's a third of the cost.
So what then do you make of the measures that are now coming out of Ottawa? Essentially, the Trudeau government proposing here a monthly doubling of the GST rebate for 6 months for those who qualify, a rental supplement, a move on dental care. I know it's not your backyard being in provincial politics, but as you talk about the suffering people undergo and the kind of daily struggle those with little money actually have to go through, what does that say to you about the current proposals? How would you assess it?
It's minuscule. We are talking about gimmicks and baubles at the federal level, all due respect to the Prime Minister, and all due respect to the Premier at the provincial level. And frankly, I'm tired of it because we are funding affluent people who would go to hockey games. We subsidize successful executives sitting in box seats to deduct 50% of the cost of those hockey tickets or entertainment expenses. They're legitimate expenses you can write off in your taxes. And we waste billions of dollars in similar write-offs for the already affluent. But poverty continues in our community, and for some reason we refuse to invest in making sure everybody can have a decent meal, a roof over their head, and it costs us in police costs, it costs us in healthcare costs, and in prison costs, ultimately, when people have a really, really tough time. So our view is, let's change our priorities, let's go across party lines and say it's time for us to invest in making sure every kid, every person gets a decent start, and we will be a fairer, more compassionate society.
Joel Harden, thanks for being with us.
It's a pleasure, Michael. Be well. Take care, everybody.
You too. Well, let's continue our look at the Liberal affordability package. Joining us right now is anti-poverty activist Leigh Bursey. He is a former city councillor from Brockville, Ontario. He joins us right now from Mount Pearl, Newfoundland. Leigh, thank you for being with us. Thank you for joining us.
Thank you so much for inviting me. It's quite an honor.
Listen, we're going to get to your assessment of the Liberal affordability package, but if you don't mind, I do want to ask you to share your own personal story, because in addition to working on poverty issues, based on your own personal experience, you know firsthand how it is to struggle with housing and income insecurity.
Absolutely. So right now I'm a 35-year-old newlywed homeowner in Mount Pearl, and I'm very grateful to be in that position, recognizing how many people that is a very elusive dream for. But that wasn't always the case. There was a time when my mother and I, based on some unfortunate domestic situations in my youth, ended up homeless in a tent. Then, of course, I was a municipal councillor, and even during those periods, we were definitely generationally and cyclically poor. And understanding that meant that we depended on family as much as we could, wherever that was possible, and the kindness of great mentors and strangers. And eventually turned that into an opportunity where I could better serve the community myself by doing something meaningful. And now I'm on the board for the Canadian Housing Renewal Association and the Canadian Alliance to End Rural Remote Homelessness, National Alliance rather, and a variety of other organizations of that nature, chartered housing professionals. And now I'm doing street outreach.
And as you say, working on something that is very meaningful to you. And as we talk about the income insecurity that Canadians are feeling right now, we know that based on polling, the vast majority of Canadians say that they are struggling with the current cost of living. So what has inflation done to those who have less means? What have you seen firsthand? What have you heard?
Well, it's interesting because a lot of people have their own preconceived notions as to why people end up poor and what some of those challenges might look like. And the fact is that while there's no doubt there's a segment of the population who may be struggling with a variety of mental health challenges or maybe addiction issues, or maybe there may have been some involvement in other means that led to that destination, the fact is that you have a lot of people who are very much struggling and are working full-time. In a service-based economy where the cost of living continues to increase, but the wages continue to stagnate. And even with some of the increases we've seen on minimum wages across the province and across the country, rather, that doesn't necessarily antiquate a better quality of life for people who are now feeling that pinch in other places. And we've seen that in the post-COVID-19 recovery, probably on a more astronomical, straightforward level than we had previously, where things used to etch up and sort of crawl towards something more unaffordable. Right now, we are absolutely seeing the pinch of inflation.
So when the federal government proposes GST rebates, doubling them for 6 months, dental care, rental support, what do you make of that kind of proposal?
I think that this is wonderful, and no doubt I would be the first one to champion any opportunity that we have to put money back in people's pockets, especially those who are vulnerable or struggling. We have a lot of people who are not getting their gas subsidized from where they work, who are feeling the pinch at the tanks, in spite of the fact that that's a progressive policy and probably with a well-intentioned result. We know that public transportation is costing more than it did at one point. So any opportunity to assist people, especially when we're talking about either first those who are struggling against rising rents in the private sector, and a variety of different circumstances that may make life more unaffordable than it did before, that's great. But I would caution that each and every one of the proposals I've seen has some temporary mandate attached to it. This is not a carte blanche check that's going to be there ongoing for any period of time, other than a short-term stimulus to help people get over the hump. And if it does, no doubt more money in people's pockets when they're struggling as it is, especially heading into the notorious Canadian winters that we're used to. It's probably a very positive thing with definitely a well-intentioned outcome. Mm-hmm. The challenge, of course, is what does that turn into?
Yeah, I'm quickly running out of time, but I do want to ask you, because as you say, well-intentioned outcome perhaps, but there is some concern about these programs, that bringing them in may actually just raise inflation even further rather than bring it down. What do you say to that?
I think that there's always that possibility, although mathematically we know that when you raise the minimum wage, as an example, that means more people spending money in their economy. Microeconomics is still economics. The idea here is that if we're willing to subsidize small businesses who were hit during COVID with debt recovery, how come we're not doing the same for those who are struggling, such as residential renters, who of course are the reason, if we're able to keep people housed, we're also able to keep those units deeply affordable and avoid unnecessary increases. The fact is that any initiative that's put in place that helps people maintain a quality of life, especially in uncertain times, is a positive one, and we definitely did trumpet it. But the challenge is that there are unknown variables, and greed is a reality in economics.
Leigh Bursey, really good to speak with you today. Thank you for the time.
Thank you very much for the opportunity.
And that is all for this edition of Primetime Politics on CPAC. I'm Michael Serapio. Thanks for watching.